in pediatrics. I'm your host Morgan Dukama Jr. Okay, so today what we're going to look at is we'll look at the introduction to pediatrics. Okay, all right. So we'll look at what pediatrics is and what it is all about. So pediatrics, the area trends. Okay, pediatrics. This is just the study. It's the science study of the psychology of kids, infants, like babies. Okay, so these it's the one that usually plays the vital role in understanding what a kid or a child is uh, thinking, or rather processing, the brain processment, as well as how a kid is well able uh, to respond to treatment, and also to understand the psychological component of children. Okay, so pediatrics is just the area trended, like it's the area treatment, it's the area treated as small adults. Okay, so pediatrics, like these are babies, like infants, so they are either treated, but they have, this simply means that these imagine these are kids, they can't talk and relate with you the way an adult can relate with you, and they cannot fully explain what is really wrong with them, but an adult will tell you to say, this is, I'm feeling this, I mean this and that. Yeah, so these ones are the kids. That's the reason why we, like, as in, they are treated as in small adults. Okay, because they have unique problems and cognitive approach. So they also have a special approach in which you can approach a kid. It's different from how you are going to approach an adult, because an adult, yes, they are able to reason well, you can they can able to follow through. We ask them questions, they'll respond, but babies, they can't talk. So in pediatrics, it's very much important for you to understand the psychology behind these babies, these children. They have unique problems and they require definitive approach. So treating children from 0 to 21. So 0 to 21, these children, and also 18 years, 14 and 12 years. So all those are children. So when one is 21 years and above, then that's when those C's become children. Okay, so human, child versus animals. So we'll also look at that, human, child versus animals, as well as the population pyramid. And okay, so here we'll look at the population setup part of Zambia. Then 42% is okay, it's below, okay, yeah, it's below 18 years. So these are, they are kids, babies, infants. Okay, what's the difference? So let's look at what's the difference here. Treating children, that is from birth to 21 years, we treat them as in children, the growing as well as the developing individuals. So these are children that are growing, and also they are developing individuals. They need to need to remember the doses. So we need to remember the doses. That's the drug doses, the intake by weight. So the intake of the drug by weight, and also important as well as the cardinal thing. Then diseases of children affected, it usually affects the growth and development. So diseases of children affect their growth and development. This can result into disorders of growth and development as a symptom. And we also have what we call the primary disorder of growth and development. So primary disorder of growth and development, these are certain disorders that really affect We also have, but the heart rate is higher. I find that a baby will be breathing very fast, even though they are just resting. They'll be breathing fast. Their respiratory rate it's very fast. Even their rate it's also fast. Okay, blood pressure is lower in younger. Okay, in younger the 80 to 85% of the total body fluids. So and that's the reason why, and it does you have a smooth skin. The spectrum of disease in children is different. So when we talk about the spectrum of disease in children is different, we're referring to the um the approach of diseases or how diseases affect kids. It's quite different as in compared to adult. Like we have what we call congenital disorder as inherited to have. So these each making up number. So if at all, let's say for example, if the mother she has any genetical defect, so what usually that means, it simply means that those genetical diseases such as congenital and inherited will be able to be passed on to the kid. And this is the reason why because mostly you'll be able to know how much probability will the mother or rather first part is congenital inheritance. These are just diseases that are prone to, remember we have the days which is those ones which well it's very much growing up. What usually happen is that they tend to all right, okay, so we were on the infectious. Okay, then now let's look at the nutritional aspect. So the nutritional aspect, these much important, and it's one of the major sized 1000 critical days because when a mother she's not feeding we call nutritional amount will be malnourished nourished, which is malnutrition. And this one usually comes as a result of a baby is not properly fed. Due to this is true for younger kids. Okay, then now let me take you back to what we call pediatric history. So this one is very much important. As a pediatrician, you need to be able to know what pediatric history is all about. Like taking two hands from a caregiver, some symptom may be non-specific. Like for example, symptoms such as crying. Maybe you see a baby's crying, maybe the baby's vomiting, and or maybe a baby is having diarrhea. So these symptoms, these are non-specific. Then we also have what we call the sequences, that is the 4 extra histories that include feeding, antenatal, as well as natal, neonatal, and developmental, as well as immunization. So these 4 are very much important. These are the 4 extra histories in a child of a in a child's life, or in a child medical assessment, especially during the under 5 developmental stage. So ought to be feeding, antenatal, which includes natal as well as, and immunization. Okay, then we have all right. Okay, so now let's look at the pediatric examination. All right. So I was saying that some signs are different in children, like you can liver, some breast, things that you can be able to examine. So when we say the breast data, that is a passage you need to palpate to examine a possible position, and also abdominal palpation, which is also easier because you use your fingertips. Non-specific signs in younger kids. So the lower threshold for investigation, to have lower threshold for investigation, major the causes of a particular infection or a disease, the time or the period of investigation. Okay, so on the major common ailment, like these are things that really affect the digestive system, where you find that the child has running stomach. So make a list of possibility with points for against. Okay, so procedure generally it is generally easier except in a very tiny or maybe drip difficult or even seduction or analgesia. Okay, these quite okay. The major subject in part 2. Okay, so major subject like this is maybe you are examining what you need to examine on. Then the separate subject. Okay, this one part 2 of MBBS. This was a separate subject since 1997. Need to pass us separately. Okay, so this one was just a certain subject that was followed under the examination of pediatrics. Then internal assessment. So under internal assessment was also done, and it has to be which consists of, okay, so this is just the examination. So internal assessment, then one theory paper, practical, which consists of long essays as well as short cases of newborn. Then we also have vivas. These are viva questions, where these are verbal questions where your instructor will be asking you questions and you'll be able to respond verbally. Okay, then besides that we also have what we call a HOSC that are done. Then the definitions in pediatrics that you need to be familiar with. So certain terminologies that you must familiarize yourself, like the first one is embryogenesis. Embryogenesis, that is 8 after fertilization. So 8 weeks after that period is called embryogenesis. So embryogenesis is a period from 8 weeks just after fertilization. Then we have fetal period. So fetal period, this is the stage between the 3rd and the 9th month. So 3rd month going to 9th month, that period is called fetal period of in intrahuman development, during which there is growth of preformed structure. So there is also growth of preformed structures that are forming. Then we also have what we call prenatal period. Prenatal period, this is 22 completed weeks. 22 completed weeks in days. This one, it is equivalent to before the birth, the gestation, that is the time when the birth weight is normally. So gestation, okay, it's a period between conception as well as when the mother gives birth. That is gestation a period. Okay, so this one, it's about it's the one that you have the time when the birth weight is normally about 7. It ends 7 completed days after birth. So it usually ends 7 completed days after birth. So a newborn baby, that is from 0 days to 1 month, that is a newborn baby. So a newborn baby is in the following range. A newborn baby is from 0 to 1 month, and an infant is from birth to 1 year. Then a toddler is from 1 to 3 years, and then a child is from primary school, middle school, and high school. Okay, then adolescent, that is 10 to 21 years, that is adolescent. Then neonate, it's also on the period between the newborn as well as the infant. Okay, so that especially on the newborn baby. Now let's look at this. Start low body weights. Okay, lipid low body weights, that is about 28%. Low body weight is low body weight when it's about 28%. Underweight 43%. Stunted, that is 48%. Okay, and 1/3 of all the malnourished children live like as in India and even some parts of Africa. They are like, these are malnutritional capital. And now contributory causes of child, these are the contributory causes of child mortality. Then we also have what we call the infant mortality rate. Infant mortality rate, it's about which is the IMR, it's about 47.5 per 1,000 born babies. Then under 5 mortality rate, it's about 62.7 per 1,000 babies that are born, newly born babies. Neonatal mortality rate, it's about 32 per 1,000 birth rate. That accounts for 2/3 of the infant mortality rate, and one and a half of under 5 mortality. 90% of all deaths are easily preventable in kids. So 90% of all deaths are easily preventable. Neonatal causes. Okay, so neonatal causes, mostly we have sepsis, that is sepsis or pneumonia, low body weight, as well as birth asphyxia, okay, as well as diarrhea. So these are certain things that can be prevented. Child survival strategy. So what are some of the child survival strategy? Number 1, early breastfeeds. Okay, early breastfeeding. You must ensure that you're breastfeeding. The mother needs to be breastfeeding the child. They need to start as early as possible. Then exclusive breastfeed. Okay, exclusive breastfeeds. A child should be properly and should be well breastfeeded. Then appropriate yearning. Okay, child needs to appropriate yearning also is very much important to take note of. Then also vaccination. A kid needs to be vaccinated. Antenatal, intrapartum, as well as neonatal care. This part is also very important. And then last but not the least, cases of management of pneumonia as well as diarrhea. These are very much important in the child survival developmental strategies. Now, why is it very much important to choose a career in pediatrics? So these are some of the advantages of someone that chooses a career in pediatrics. It's very vast. Well, okay, very vast, which simply means that it's very broad. There are a lot of things that you need to know. Yes, there are a lot of things that you need to learn, and there are a lot of things that you need to know and be exposed to. It's variety. Then again, okay, it's tough. Okay, yeah, it's tough, but yeah, you need to. It's tough, but it's worth it. Yeah, it's tough, but it's worth it. Satisfying, that is you need to incorporate the heart and the science of medical practice. Then ambulatory, that is indoors emergency intensive care unit. You also need to this part is also very much important, where you learn about the ambulatory, that is in the ambulance and whatnot. Then also the indoors, the emergency, and the intensive care. Then besides that, we also have what we call the subspecialties. Subspecialties includes, okay, so if one has done pediatrics, you can get yourself a specialty. These subspecialties that usually includes neonatology, which is just the study of these neonate, knowing them, like the newborn babies from 0 to 6 months. So these ones you need to know them. So in here you study their psychology, and you'll be able to quantify, meaning that you become a specialist and in that department. Then also neurology, that is the brain, usually borders the brain capacity of the child. So this one also, you can get yourself a specialty in neurology as well as neonatology. Then it is also vast in research. Research are currently going on. Then also it has a community as well as the public health sector. Even lifetime is not enough to master even just one specialty. So this is why I say that pediatric, it's vast and it's broad. So even just a lifetime, it's not enough to master just even one specialty in pediatrics. So if the quest continues, you will then enjoy the journey. Now remember, you always learn something new from each patient. This is number one cardinal important key factor. You always learn something new from each patient. So each patient that usually comes to your department or to your ward, you must be able to learn something new from that particular patient. However, the maiden you think is okay, you need to think what all these problems are. Okay, so this has been your host Morgan, the Pais Jr. Ensure to subscribe to my YouTube channel and hit the notification button to be able to be updated for every content that will be shared on this platform. Thank you so much.